lot of people don't know what glaucoma is because they don't know anyone who's been diagnosed with glaucoma. And they don't know anyone who's been diagnosed with glaucoma because someone who actually has glaucoma never got diagnosed with glaucoma. And so not knowing kind of feeds into the false lower prevalence numbers. And so I think by having updated numbers in terms of prevalence, I think that pushes the knowledge about glaucoma to the fore. It takes up more public space, more public discourse, and that means that we could actually do something moving forward. So I think having those updated numbers, collecting that information regularly, would shed a lot more light on the actual state of the condition, the prevalence and how many people are affected. And in addition to just raising awareness, that goes back to the first point that I made. If you've never heard about glaucoma, it's because you don't know anyone who actually has glaucoma. But that doesn't mean that they don't have glaucoma. It's just not taking up a lot of space in the public discourse. And so no one, it's not something that people that you might get tested for. So in addition to raising awareness about the condition and the need for additional research and funding for early detection, etc., having those updated numbers and being more on top of the prevalence could actually spur people to go in and get tested. And then that, in the long run, 5 to 10 years, you have more people who get tested for glaucoma early enough. You can delay disease progression, slow disease progression. And in 50 years, that may translate into not just not having to spend X million dollars or X billion dollars on healthcare, eye care costs for these individuals because they have lost vision. So that doesn't have to happen anymore because we have so many hundreds of thousands of people who have now gone in to get tested because there's more discourse about glaucoma.